Hello, my dear medical students and junior doctors. This is Dr. Costa. Welcome to today's video podcast on gynecomastia. Gynecomastia, which is sometimes referred to as man boobs by the general people, is a common condition that causes boys' and men's breasts to swell and become larger than normal. It is usually caused by an increased estrogen to androgen ratio. Please be mindful that male breast enlargement can happen due to lipomastia also, which means the excess deposition of fat in male breasts, which is commonly seen in obese males. When there is excess glandular cells in male breasts, it is called gynecomastia. These images shows us the appearance of gynecomastia. Clearly, this man has this breast enlarged compared to the other one. Here, not only the breast size is enlarged, but also the areola and nipple size is enlarged. This image is showing us the proliferation of gland tissue within the male breast. There is a surgical option that cut around the half of nipple to remove gland tissue plus minus liposuction for fat to improve the appearance of gynecomastic breast. This video is sponsored by Costa Medic. If you are a medical doctor looking to get involved in medical research but you don't know much about biostat, statistics software, data analysis and result writing, then Costa Medic offers you a course which would enable you to perform data analysis and result writing for your future research projects. The course is designed for the complete beginners, so no prior knowledge of research and statistics are required. The course link is given in the description box. Gynecomastia can physiologically happen in 3 distinct periods of life. For example, in neonatal period due to maternal estrogens crossing the placenta, during puberty due to low testosterone and dihydrotestosterone or DHT, and during adult life typically 50 to 80 years old, which may be due to primary testicular failure, obesity or alcohol excess. Causes of gynecomastia. The physiological causes were already discussed. Syndromes with androgen deficiency, for example Kallmann syndrome and Klinefelter syndrome, also causes gynecomastia. Klinefelter syndrome happens due to a chromosomal abnormality. The chromosome count is 47XXY, which means there is an extra X chromosome. Typical Klinefelter syndrome patients have tall stature, delayed puberty, gynecomastia, small firm testes, and it is a cause of hypergonadotropic hypogonadism. So if you test these patients, they will have high level of gonadotropins. Whereas in Kallmann syndrome, we see hypogonadotropic hypogonadism. Kallmann syndrome patients are phenotypically similar to Klinefelter syndrome, but Kallmann syndrome patients have anosmia or impaired sense of smell. Certain testicular pathology, for example, complications of mumps, testicular cancer, for example, seminoma secreting beta HCG, and Leydig cell tumor can also cause gynecomastia. Leydig cell tumors often secrete high level of estrogen. Sometimes ectopic tumor secretion, for example, secretion from small cell lung carcinoma, can also cause gynecomastia because these tumors can secrete estrogen into the blood. Liver cirrhosis can also cause gynecomastia because in liver cirrhosis the steroid hormone metabolism is impaired. So there is increased amount of steroid which causes increased amount of estrogen. Chronic renal failure patient in hemodialysis, during the end stage renal failure, can also develop gynecomastia. Hyperthyroidism and certain drugs can cause gynecomastia. These are some of the common drugs causing gynecomastia: cimetidine, digoxin, antiandrogens like cyproterone acetate and spironolactone, some exogenous anabolic steroids, and also cannabis. Certain other drugs can cause gynecomastia as well. For example, prolonged use of omeprazole can cause gynecomastia. Sometimes finasteride and excessive heroin abuse can also cause gynecomastia. Spironolactone can cause gynecomastia by several mechanisms. It can block androgen production by inhibiting enzymes in the testosterone synthetic pathway. It can also block receptor binding of testosterone and dihydrotestosterone. It can displace estradiol from sex hormone binding globulin, which increases free estrogen levels. Most adult males does not have any symptoms of gynecomastia, but some patients may complain pain, particularly in adolescents, swollen breast tissue, breast tenderness, nipple sensitivity with rubbing against clothes, and obviously some psychological conditions may arise in gynecomastia like depression and low self-esteem. Now, how do we diagnose gynecomastia? At first, we need to take the full history of the patient, and then we need to do the relevant physical examination. Apart from examining the breast of the patient, we need to also check for the signs of puberty, check for the testis if it is small, undescended, or if it is bulky, which may suggest some tumor. After doing a complete physical examination, we can give some tests like breast ultrasonography and breast mammography. Hormonal tests are always done like testosterone level, some female hormone levels like LH, FSH, estrogen, and HCG, and also prolactin level is seen. At this point, I should tell you that high level of prolactin can cause galactorrhea or breast milk secretion, but it may not be a cause of gynecomastia itself. The causes for gynecomastia and causes for galactorrhea are different. Here are the treatment options for gynecomastia. The first one is observation. Physiological gynecomastia during the childhood and during puberty can resolve over time. Androgen replacement therapy may be helpful for those patients who have low testosterone level, so we can give testosterone to these patients. Selective estrogen receptor modulators like tamoxifen and raloxifene also have some role in treatment of gynecomastia. These drugs are also prescribed in breast cancer patients. Some surgical options are also available. For example, liposuction. Liposuction is particularly helpful for the obese patients, those who have primarily lipomastia. Subcutaneous mastectomy is a good option for more advanced cases, and finally, open mastectomy can be done for the most advanced cases. If you have got any value from this podcast, then please hit the bell icon and subscribe button to support me.